We've chosen to take within this project an approach of getting out of our comfort zone, getting out of our silo, getting out of our box, and recognising that if we're to really tackle hardship, if we're to really tackle crisis in people's lives, then we actually need to get out of our CABs, out of our bureau, out of our offices, and out there and working with the community. And that's really important. That's why we've chosen an approach of assembling such a wide diversity of different agencies.
We're not used to working quite often across silos and with different communities, not because we don't want to, but because the pressures of our own work often limits us within our own spaces. So what we want to do today is actually start to explore what does a whole system service look like for people who are in complex needs and in hardship.
We know that in order to tackle hardship and crisis, we need to build relationships between statutory, voluntary, social, faith and community agencies. And the way we do that is by bringing people together face to face to talk about the issues, to talk about the systemic problems which cause and exacerbate hardship. What we need to do if we're to really tackle hardship and crisis is look at the whole system and act on the whole system and recognise that we as agencies, statutory, voluntary, community, social, faith, networks, etc., we're all part of a system. We're all part of an ecology of provision.
When my colleagues in the council or in the mental health trust or in the primary care trust, when they talk about whole system working, and we've heard a lot of that talk, essentially what they do by and large is the institutions are working together in better ways. Actually what we know is that most of the system, 90% of the system actually exist outside institutions. And part of what we've done here in Wandsworth over a very, very long time is understand where these other systems are and see whether we can do early action inside these systems.
You know, our vision is about enabling people to take the lead, and actually, as you said, where people come together is in their social networks, it's in their communities, it's not necessarily always in statutory services and places that we've traditionally expected people to be. If we always do the same things, we're always going to get the same results. So how do we start to support people that want to tackle the root causes to take that one step earlier?
We have networks in place, we have relationships in place, we understand the issues of hardship and crisis. Can we now use this opportunity to unlock the talent that exists within our communities?
What we're trying to build here is a better way to deliver sustainable, community-centred advice services, which will eventually become the mainstream way of delivering our service. So what we've learnt over the first year of the project is going to influence the way we deliver all of our services in the future. It's not just about this project taking this approach.
The diversity is now the single clearest characteristic of the city. And so as policymakers, that's both a tremendous inspiration, but also an enormous challenge, because it means we need to find new ways to understand where people are coming from as individuals, as well as communities.
You go to other boroughs, you're not going to see an audience where you've got leaders and chief executives and Muslim leaders and bishops and imams and different people all in the same space, actually having difficult conversations.
We haven't really addressed the issue of discrimination as being a really important barrier, and one of the things that produces some of the hardship and some of the crisis situations that we experience. Disproportionate numbers of certain groups lose their jobs or they can't get jobs, and that leaves them incredibly vulnerable. You can't live if you actually can't, take responsibility for yourself. So I guess a number of different things, but one is addressing some of those very, very real but difficult to talk about issues. And I was really pleased that today at least we named them.
Many agencies, they work on the particular issue that they're set up and funded to work on. They deal with one single issue. Now, most people who are experiencing hardship and crisis don't have one single issue. They have a multiplicity of issues that they face. Their situations are complex.
We really need to move services from a reactive to a proactive basis and look for preventative approaches wherever we can. But that means really reaching out to communities. It means not assuming that people will come to us all the time, and it means that we need to find different ways of engaging with people. And as statutory bodies, it's difficult to do that at times. It's difficult to know the right way to go about things. So we already build quite a bit of involvement and engagement into our work, but I think that needs to go further, and it's that gap between involvement, engagement and genuine co-production. That's the one that we need to close. It's not always easy for statutory bodies. We sometimes come from a slightly different mindset and approach, but I think we need to challenge ourselves on that.
You used to talk about like patient journeys, which sort of means that people move from one bit to another, and I think actually people are in a sort of matrix really, and they sort of move around and they have different bits of care at different times. The exciting thing about today is it does give that, there's an option for early intervention, so people to get in earlier. It's about accessing people who might not want to access traditional services.
I think it means much more open thinking in terms of the Mental Health Trust in relation to involving partners at a much earlier stage, and we want to avoid making people service users of mental health services where we can avoid that and make sure that people remain within mainstream services and that we provide support and advice to those services rather than people having to come to the Mental Health Trust to receive our input.
We can't assume that just because somebody isn't shouting loudly for something that they don't need it. And we need to make sure that we have a very balanced and fair and nuanced understanding of the need of our communities, and that we're making services responsive as well.
Well, I think it's always very difficult to focus on having the time to build those relationships and build those networks. And so I think the next step is probably to ensure that we carve out pieces of time where we can continue to come together and continue this conversation and make sure that it really retains its vibrance and remains as important in everybody's minds as it feels today.
We're living in a digital era, and we've all got these smartphones in our pockets, and we're living in a time when social media is a prevalent feature of everyone's lives, particularly for young people, of course. But actually, there's no substitute for being with people, listening and working together. And that's been one of the great things about today's event.
I think it's been absolutely brilliant. The conference has been really enlightening. I think it's been great to see the strength of relationships that exist across the partnership, and the fact that you are all so open and honest with each other. You're challenging, you're reflective, and you're thinking actually individually how can we improve, but collectively how can we do better for our communities, and I think that's very powerful and really positive.